Florida Cancer Specialist and Research Institute. I'm so excited to introduce you to our doctor friend here this morning who's going to be talking about something very important when it comes to cancer. This is Dr. Wade Weaver, and this morning we're going to talk about clinical trials when it comes to cancer treatment, which is a big part of the puzzle, if I'm not mistaken, right, doctor?
It is. It's a big part of all medical advancement, but particularly in oncology and cancer. Cancer is something that we learn a lot about at a very rapid pace. There's a lot of funding and interest in cancer research and developing new and better treatments for patients. And so clinical trials are a big part of that.
I think there's also, though, a lot of misconceptions, though, when it comes to clinical trials, right? No, it's a very tough time for people when they are battling cancer, trying to figure out what the best treatment is. And then you go, okay, what trials should we do? Should we even participate? Clear up some of those misconceptions.
That's exactly right. I mean, these are patients that are going through something this dramatic for the first time, and they're trying to make rapid steps, but make sure steps at the same time. And so I think a lot of patients come into this afraid of clinical trials, that they're going to be a guinea pig and they're going to be experimented upon. But clinical trials are something patients should seek. The opportunity to participate in a clinical trial is something they should see as a positive aspect of their care. Maybe there's not a trial for them that they fit into, but it's something that should be explored. I think patients are afraid that they're going to get placebo and not get any treatment at all, whereas the majority of clinical trials include the current standard of care treatment with the possible addition of an experimental agent that has shown some promise in previous studies. And you may also get a placebo added to the standard treatment, but the standard treatment is always a part of the treatment. And so patients who participate in clinical trials are still getting very good standard of care treatment, but have the opportunity to perhaps receive something extra.
Well, and also goes into phases as well, which I know you wanted to make sure people understood as well. Phase 1 meaning what? And there's 3 phases?
That's correct. 3 phases of clinical trials before the FDA will approve a drug for use. Phase 1 is very entry-level dose finding. Let's find out what doses human beings can tolerate. Not as much interest there as what works or what doesn't, but more how do patients tolerate. When you get to that 3rd phase, just before FDA approval, that's where you're combining the experimental drug with the current standard of care that's shown to be effective. And so again, patients who participate in that really help advance the understanding of cancer treatment, but they also get very good treatment for themselves.
Well, and I think as we wrap up, I think people get very excited when they hear that there may be a new treatment available. How soon do these drugs typically go to the market after a trial has been done?
So it really depends on the particular cancer. Cancers that are more aggressive and tend to have, unfortunately, a shorter life expectancy, we tend to get answers to the clinical trials a little bit sooner. Whereas cancers that have a better prognosis, where patients live a number of years with treatment, while that's very good, of course, for our patients, it does delay a little bit getting the answers and the information.
Okay. Well, as we kind of wrap up, what's your take home? For someone watching this morning, maybe they are kind of facing that big C word here recently, or maybe they have a loved one. What is your message when it comes to clinical trials that you think people should really remember?
Well, I think patients who are motivated, who are educated about the process, and who want to participate, they come in asking for clinical trials. Do you have any clinical trials available, as opposed to us even having to suggest it. So not all patients, of course, have that wherewithal, but it should be something that patients are seeking, that opportunity, at least to explore. It may not be something they end up with, but at least to have that as another option on the table. Well,
Dr. Weaver, thank you so much for allowing us to be here this morning, for giving us a little bit of your time. I know thank you for all your studying that you've done, and again, to help hopefully one day find a cure for this. So thank you so much, doctor.
Thank you.
All right, and then of course, for more info, all you have to just head to our website as well. That's tbmorningblend.com.